Hello, my name is Andrew Koo. I'm one of the physicians at CU Medicine, Department of OBGYN at Highlands Ranch Hospital, and my Fitmas tip revolves cervical cancer prevention. Cervical cancer is a cancer of the cervix, which is an organ that sits between the vagina and the uterus. And cervical cancer is a very preventable cancer that we see in patients. We start screening for cervical cancer at age 21 in all people with a cervix. That is done by performing a pelvic exam and a special test called a Papanicolaou smear, otherwise known as a pap smear. If your pap smear is normal between the ages of 21 and 29, we recommend screening every 3 years. Starting at the age of 30, we add on testing for the human papillomavirus, otherwise known as HPV. If your pap smear and your HPV testing are normal, then the screening gets to be spaced out to every 5 years. Cervical cancer is an extremely preventable disease and one that is decreasing in the developed world. One thing that you can do to help yourself, aside from getting routine screening with your doctor, is to also make sure that you've received the HPV vaccine, otherwise known as the Gardasil vaccine. You can receive that vaccine all the way up until your 40s. And so if you have not done so yet, we highly recommend that you get that, as it is one of the few vaccines that we know that can prevent cancer. The American Society of Cervical Cancer Prevention recommends pap smear testing for people between the ages of 21 and 65 years of age. Pap smears can be collected by people like myself, an obstetrician gynecologist, or by many primary care doctors. One thing to remember is that pap smears are a screening tool. Having an abnormal pap does not necessarily mean that you have cervical cancer, but it does mean that your doctor needs to do more investigation to prevent you from getting cervical cancer and to keep you healthy and well. It is really important to have good follow-up with your doctor and make sure that you continue to have conversations regarding your health.